Medical things they don't tell you. Cancer detection technology is advancing at a rate that's insane. So let's say you have a blood cancer. The way we find out you have a blood cancer is you come in with symptoms like fatigue, you're pale, you're bleeding and you're bruising, your body's not using its platelets correct, and so on. We do a bone marrow biopsy and we find out that it's filled with cancerous cells. Decades ago, a special kind of doctor called a pathologist would be the one that looks at the cell, in particular with their bare eye under a microscope, right? And so they would be the ones trying to see if this cell looks like it's cancer or if this cell looks like a normal cell. You can imagine that the human eye can only pick up so much, and even then, from pathologist to pathologist, things can be interpreted differently. But now, instead of just looking for the certain cancer cells, we have technology that's able to look at certain genes if they're present or not. So that's something that the naked eye, even through a microscope, won't be able to pick up. And that means we can tell if a cancer is really in deep remission or if it's not in deep remission. And that actually dictates how much treatment we give the patient. Because if someone achieves a deep remission, at least by 2024 standards, maybe it changes by 2027, 2028, who knows? But if they're in deep enough remission, we can think to ourselves, well, maybe they don't need further chemotherapy or immunotherapy. So the way that we're detecting these different types of cancer cells is getting more and more sensitive. It's like you used to be able to see if there's a big car inside a football stadium. Now it's like we're able to locate if there's a nickel inside a football stadium. Like that's the scale that we're dealing with the technology that can tell you there's like a few cells that have cancer and you should do something about it, because if you don't, they grow, they fester, and the cancer comes back.